Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, what are the recent advances in the treatment of rheumatoid arthritis? In the treatment of rheumatoid arthritis, we have drugs like anti-tumor necrosis factor alpha drugs. Okay, these anti-tumor necrosis factor alpha drugs include infliximab, golimumab, adalimumab. Then we have sertolizumab. Then we have etanercept. Are the drugs which are anti-tumor necrosis factor alpha drugs. Okay, these anti-inflammatory drugs are actually immunosuppressants. They are in the class of immunosuppressants and thus they have some risks. So usage of anti-tumor necrosis factor agents can cause can have the following risks. Like for example, when we use anti-tumor necrosis factor agents, then these can cause reactivation of latent tuberculosis, which is actually most important risk factor. They can also cause serious fatal blood infections can be seen because of this, or blood disorders can occur due to anti-tumor necrosis factor and antagonists or agents. Now serious infections can occur. There can be side effects like lymphoma or solid tissue cancers can occur. Serious liver injury can occur due to anti-tumor necrosis factor antibodies, sorry, antagonist, anti-tumor necrosis factor antagonists. Or it can also cause reactivation of hepatitis B, or they can cause lethal hepatosplenic T cell lymphoma. They can also cause drug induced lupus, or they can also cause demyelinating CNS disorders. So when we use anti-tumor necrosis factor drugs, in those drugs, while we are using these drugs, we should be cautious about these conditions, because these conditions might develop because of the immunosuppressive effect of these drugs.
thank you and thank you for watching.